So good afternoon and welcome to the Rotary Club of Madison. I'm George Hidalgo, Club President. Thanks for joining us. Now, we originally had planned on meeting at the Alliance Center today, and this would have been our first meeting in-person meeting since the pandemic started. But obviously, with the rise in COVID-19 cases, emergency order number 7 changed the quantity of people that could meet from 50 to 10. So obviously that posed a challenge. And then once that was an issue, then the Alliance Center basically said, hey, we can't host anyone. So that posed a little bit more of a challenge to us. So obviously we're going to continue with online meetings. Now, these online meetings are made possible and thanks to Brian Baskin and Jason Barron. And we're here in the conference room of Pearson Engineering. So our continuing thanks to Brian and Jason for allowing us to continue to meet virtually. So let's open our meeting by reciting the 4-way test of the things we think, say, or do. So is it the truth? Is it fair to all concerned? Would it build goodwill and better friendships? Will it be beneficial to all concerned? Thank you. While I don't plan us to recite the 4-way test every week, I want to use it today because I'm planning adding a 5th item to the 4-way test. So perhaps we can call it 4-way test plus, or maybe we can change it to 5-way test. But either way, one of my goals while serving as your club president this year is to have more fun. So I'm adding a 5th item to our 4-way test, and that 4th item is the following. So as you can see here, will it be fun for all concerned? Obviously, we want to have fun and we want to live that. So let's go ahead and put it into our 4-way plus test or 5-way test. And that'll be for this year. Let me add it to our banner. So I think it looks great right there, and we'll need everyone's feedback and in order to ensure that we do have fun. And obviously, having a virtual meeting makes it more challenging. But I think working together, we can make these meetings very engaging and entertaining for everyone. So I'm going to start each of our meetings by highlighting an important topic for our club. So I'll start today with emphasizing the importance of the Rotary International Foundation and exactly what role we play with that foundation. So we hold an annual campaign for the Rotary International Foundation each spring, and this is, remember, a separate foundation from the local Madison Rotary Foundation. So this spring we had 195 members who participated in the Rotary International Foundation campaign. And what's impressive, even during this pandemic, if you think about it, since March till now, we're still in the middle of it, we were able to raise $44,565, which averages to $100 per member. And I'd like to thank Charles McLymans for serving as chair of the campaign this year. So if you think about it, we as a club raised that much money during a pandemic. So thank you very much for everyone who participated. And that's 196 Rotarians, and we obviously can always try to get more. Now, our club's Change for Story is a good example of the type of project funded from our gifts to the Rotary International Foundation. Our local foundation provided nearly $25,000 for the Change Her Story project last year. Now, with district and Rotary International Foundation matches, our $25,000 became $125,000 to support this project. Now, that's pretty amazing in my opinion. So, but I'm probably not a judge because I'm not a good judge because I'm not in the financial industry. So there's two things. I'm going to call out some people here. I've got the handy dandy here roster of all our Rotary members, right? And I'm going to call out some people who actually work in financial institutions and can actually say, hey, that's really good. That is amazing. Or maybe another adjective. And some of you who are on YouTube chat, please chat back to us. What are some better adjectives than amazing? So let me call out some people who, according to this, are in financial institutions. We got a Melissa Fellows. We got Amber France. We got Tara Grays. We got Mark Green, Justin Hart, Paul Hoffman, Stanley Copeman, John Sims, and obviously Dave Vitale, Christine Ash. So there's a lot of people here that know about finances more than I do. So why don't you, if you got to have a better adjective than I do for taking $25,000 that we donated and turning it to $125,000, if that's not amazing, give us a better word. And I appreciate that if you use the YouTube chat function and go ahead and post your comments. It is, in my terms, pretty amazing. And those that are in financial institutions, hey, am I full of you know what? Or is this actually true? Is that a great number? That's what I want to know. Are we getting some chats in? Some words coming in? Okay. So go ahead and take a minute and just tell me if you agree that that's amazing. Taking $25,000 and in 3 years turning to $125,000 or what? Let me know. Because that's fantastic that we got that type of input. Okay, so we are getting some participation, so thank you very much. Now, during this time of COVID-19, the Rotary International Foundation provided a $25,000 disaster relief grant to our district. Our club, along with 30 other Rotary clubs in our area, shared the $25,000 to distribute to organizations in our community to help out. So our club's grant was given to Second Harvest Community Bank to provide care boxes to families in need. So our Community Projects Committee is also providing volunteers to help put together the boxes. That's also pretty amazing, or maybe another adjective. So I like to highlight those things with our support of the Rotary International Foundation. And again, remember, we have our local Madison Rotary Foundation, and we have the international, and it definitely highlights that we do a great deal for our community, not only on a local level, but on a state level and also on an international level. So it's a great example of how we give back to the community and beyond. So Rotarians, thank you for making it happen. And the one thing, I know it's really hard with social and physical distancing to really feel proud about what you're doing or getting a positive affirmation. So I'd like you to do one thing now. If I was on Zoom, I would be able to see if you're doing it. But I'm going to ask you to raise your hand, okay? And then turn your palm toward the rear, right? And then go ahead and flex your elbow, right? And pat yourself on the back, okay? So you should actually feel proud of being part of an outstanding Rotary Club, and that's the Rotary Club of Madison. So thank you very much. With that, we have special music today. So Debbie Biddle is going to sing Edelweiss for us. Debbie?
Small and white, clean and bright, you look happy to greet me. Blossom of snow, may you bloom and grow forever. Edelweiss, bless my home and forever. Edelweiss, every morning you greet me, small and white, clean and bright. You look happy to meet me. Blossom of snow, may you bloom and grow Edelweiss, Edelweiss, bless my home and
Well, thank you, Debbie, and you have an amazing voice, and I want to thank you for sharing that with the rest of the Rotary Club. Really appreciate it. So let's go on to new member introduction. And I know we had 6 members we introduced last month, and I'm really elated to be introducing another one at this meeting. So let me introduce, and we have Darren in person here, so this is fantastic. So Darren J. Harris has been loaned the classification of consulting and is co-founder of Journey of Collaboration. A native of Los Angeles, California, Darren now makes his home on Fax Avenue in Madison with his wife, Dawn McCluskey. They have 2 adult daughters. Darren holds a bachelor's degree in human resources management from California State University. He also holds a master's degree in public affairs from UW-Madison. He's a past board member of the Network for Continuous Change and Innovation in Higher Education. Darren serves as the trustee of the Madison Zen Center, where he also continues to serve as the directing committee member. So as the pandemic stress continues, Darren, I will definitely be touching base with you on that. So he has partnered with the United Way of Dane County to address more than 20 local community challenges, including elderly falls prevention, housing first, and summer reading loss, and serves as a committee member of the Dane County Office of Energy and Climate Change's Public Engagement Work Group. He has also served as an affiliate faculty member at UW-Madison's Lafayette School of Public Affairs. His interests include running, biking, gardening, meditation, and sustainability. Darren's sponsor, Bob Block, is also joining us for today's meeting. So welcome to Darren, and thank you to Bob Block for sharing Rotary with Darren. So let's give him a warm thank you. Okay. And Darren, if you want to say a couple words, please.
Thank you. Appreciate it.
Go
I can come up here. I'll
Yeah,
approach the mic. Well, thanks to the club for having me. It's an honor to be part of this esteemed group of people. I look forward to meeting you in person, of course, as all of this allows and the COVID unfolds. Look forward to seeing you all soon. Thank you for having me. Thanks for being here in person.
So that's fantastic to have a new member join our group, and it shows that we can continue to get members. So remember, I emphasize the power of one. It is not the club membership committee's responsibility to attract members to our club, and they can provide the process and some of the handouts and things along those lines. But really, the responsibility is for each and every one of us to share this great club with at least one member in your network. So think about that. And Bob, thank you very much for what you did and having Darren join our organization. I appreciate that. Okay, announcements. Dues billings. I wanted to give a quick reminder about the dues billings that were sent out a few weeks ago. Payments are due in the Rotary office by July 31st, and we appreciate if you get them in by the deadline. Now, our next week's Rotary meeting will talk more about why meals have been included in the billing for this 6-month period. Now, we have an ad hoc committee working on a review of our fee structure and membership types, and they'll come to our board with recommendations in early September. I ask for your patience and your understanding. Next up is birthdays. We have birthdays to celebrate with a little bit of humor or wisdom that complements Rotary's mission. We also encourage members to make an age-appropriate gift of the Madison Rotary Foundation, rounded up to $100 for our club's Synergy Scholarship Fund. And now we're going to celebrate 2 weeks of birthdays since we didn't have a meeting last week. And before I start calling off names, one of the things, just a little bit of my background, obviously I go by George, and it's George Hidalgo. But throughout my life, my name has been mispronounced repeatedly. So it's gone from Jorge Hidalgo, George, and you name it, it's been slaughtered throughout my career. So I'm going to do the best I can, but recognize that there's one quote that I like, is revenge is a dish best served cold. So for those that I mispronounce, just understand maybe it's payback on a cosmic level. So with that, June 28th, Renee Moe. June 28th, Sally Jo Spaney. June 30th, Len Deveshire. June 30th, Michael May. June 30th, Lee Schwartz. July 2nd, Steve Goldberg, who shares this quote: "As I celebrate my 70th birthday, I take great delight in knowing that this means I have finally caught up to my friend, Lester Pines." Another July 2nd birthday, Oscar Morales, who my understanding was recently with his family in Tucson, Arizona, who shares this quote from author Barbara Kingslover: "The change we dread most may contain our salvation." July 3, Annette Helmer. Also July 3, Patrick Marsden. July 4th, Independence Day, Ted Crabb. July 4th, Nathan Wattier. July 4th, Trip Witter. July 7th, Steve Musser. July 9th, Greg Michaels. And July 10th, Stan Coatmans. Thanks to our celebrants for their contributions to the Madison Rotary Foundation. Let's listen to Elaine Mishler play Happy Birthday. Thanks, Elaine. Next, we have headlines announcements. And one of the things that I want to emphasize, we are blessed with such an incredible group of Rotarians that sometimes we don't even know everything that they do in the community. We have a stellar cast of characters that are in our Rotary Club, really impressive list. So as time allows in the agendas, what I'd like to do is highlight one of the members in the news. And I'll start this week with Dawn Krim. Now, Dawn has been a member of our Rotary Club since 2007. She serves on our classification committee and is currently vice president of our Madison Rotary Foundation. She also serves on our scholarship committee and has been a mentor to a Rotary scholar. Now, fellow Rotarian Dawn Krim, Wisconsin Secretary of Safety and Professional Services, DSPS, was recently highlighted in Madison 365. Now, the DSPS issues more than 240 unique licenses, administers dozens of boards and councils that regulate professions, enforces state building codes, and maintains the Wisconsin Enhanced Prescription Drug Monitoring Program, which is a key tool in the multifaceted public health campaign to stem excessive opioid prescribing. Its overall mission is to promote economic growth and stability while protecting the citizens of Wisconsin as designated by statute. Now, the Department of Safety and Professional Services employs more than 250 people across 5 offices throughout the state, providing a wide range of services, from building and boiler inspections and plan reviews to professional credentialing and state fire prevention programming. Now, those who just received our new property assessment will like the agency structure. So, in fact, you can go ahead and put on chat what your assessment increase was, well, the ballpark figure anyway, to see how much fun we have to get audience participation. But I have heard that comment. I don't live in Madison. I live in Sun Prairie, but that's what I've heard from my friends who live in Madison. They had a pleasant surprise with the new property assessments. So here's the news, and you'll love Don even more. DSPS is a fee-based agency. It is self-sustaining and receives no general fund tax dollars for its day-to-day operations. It collaborates with constituents and stakeholders across a wide range of industries to promote safety and advance the economy. So a great example of their work is that the construction industry has continued to operate throughout the pandemic with minimal disruption. So if you think about it, in order for all that construction to take place, they have to put out the guidelines and enable it to happen safely. And they did a phenomenal job, because most of the people I speak to in the construction industry, and I would say we have 2 people here with Brian Baskin and Jason that shake their head and say, yes, Don's organization has enabled the construction industry to continue to proceed with minimal disruption. And basically, in terms of all the projects, there's been almost no layoffs in the construction industry. So Don is providing the right leadership at the right time to our community and state. Now, my heart fluttered when I read her quote. We want to continue to be as efficient as possible with the resources that we have. So as you know, I'm a small government person, and my heart just fluttered when I heard someone in the government actually say that. So it reminds me of the movie Jerry Maguire, when Renee Zellweger, I think it's her name, was asked by Tom Cruise, what was going on, and she said, "You had me at hello." Well, I tell you, Don had me at, we want to continue to be as efficient as possible with the resource that we have. So I think I want to highlight Don, and we're so proud to have you in our Rotary Club. And you exemplify the caliber of Rotarians that we have. And thank you for everything that you do for our community. Now, there are other members in the news, and I'll just mention the names briefly. Masoud Akhtar, Stu Leviton, and Michelle Orge were pictured and quoted in articles. So on the email that the Rotary Club sends out on Friday, there'll be some details as where you can access the information on those outstanding Rotarians that receive recognition from our community. So with that, I'd like to go ahead and start our program. Our speaker today is Dr. Julie Willems Van Dijk, who serves as Deputy Secretary of the Wisconsin Department of Health Services. Dr. Willems Van Dijk earned her doctorate degree in nursing from University of Wisconsin-Milwaukee and is a fellow in the American Academy of Nursing. Now, she most recently served as the Director of County Health Rankings and Roadmaps, a national collaboration between the University of Wisconsin Population Health Institute and the Robert Wood Johnson Foundation, providing data, evidence, and guiding to over 3,000 counties who are building a culture of health. Prior to joining the Institute, she was the Marathon County Public Health Officer. Today, Dr. Willems Van Dijk will speak with us about controlling the spread of COVID-19 in Wisconsin. And as time allows, after her remarks, member can use the chat feature in YouTube if you have a question for our speaker, which I hope you have a lot of considering what we're facing. Maybe you can ask her about why go from emergency order number 7 to emergency order number 8, which means that effective Monday on the 13th at 8 a.m., we will be requiring masks in all buildings that are not a home. And I guess we can have questions and have you elaborate on that. But, I'm really looking forward to his speech, and I hope you are too, her presentation. And please join me in welcoming Dr. Willems Van Dijk to our podium.
Thank you, George. It's a real honor to be here with you with my mask, but since I'm 6 feet away and we are all 6 feet distanced here, I will take it off so it's easier to see my lips and hear me speak. It's also an honor to be introduced after my great colleague, Dawn Krim, the Secretary of the Department of Safety and Professional Services. She's a great colleague. And thank you so much for everything Rotary does. I've been a fan for many years and actually have the 4-way test on a Post-it note in my office. And now I'll have to add the 5th because fun is something we all need to keep track of during these times. So I'm here to talk today about COVID-19 and our boxing it in strategy. So there's 3 things I really want to focus on over the next 20 minutes. And again, I welcome your questions at the conclusion of my remarks. But I want to talk a little bit of background on COVID-19 and where we've been. Then I want to talk about our current statewide strategy to control the spread of COVID. And then we'll end with some current events and current data. So let's dig in here. There we go. All right. So lots of times people talk to me and ask me about COVID, and one of the most common questions I get is, why is this so important, and how come we're so crazy about this compared to influenza? Well, the reason for that is COVID-19 is a novel virus. What this means is when it emerged on the scene back in December of 2019, no one in the world had immunity to it, and we had no treatment for it, and we have no vaccine to prevent it. And therefore, we're in a bit of a bind because the whole world is susceptible. So that presents a really big challenge to us. And what we also didn't know at that time is how virulent it was, how easily it spread from person to person. We found out pretty quickly it spreads pretty easily. And we also didn't know what kind of fatality rate we would see. And we are still figuring these things out, which is the other challenge of a novel virus. We don't have a big body of research or evidence to draw from. And so we are learning as we go and adapting as we go. And so in the beginning, it appeared that the fatality rate might be as high as somewhere between 5 and 10%. Currently in Wisconsin, of the cases that we know of, 3% of them have ended with the loss of one of our fellow Wisconsinites. Nationally and internationally, it is appearing the fatality rate is probably closer to 1%, but this is something we continue to learn about. Now, why that is important is, yes, every year we do have people die from influenza, but a much lower rate than that. The typical fatality rate for influenza is about 0.3%. So if we're even in that 1 to 3%, we're anywhere from 3 to 10 times as high as influenza. So we needed to take pretty significant action in order to control the spread of this disease. It does spread by respiratory droplet, and respiratory droplets, if you have all heard, travel about 6 feet in normal conversation, even farther when you cough or sneeze. And so that is why you hear counsel about physical distancing of at least 6 feet. And those who are most at risk are people who are over age 65, people who have other health conditions such as heart disease, respiratory disease, diabetes, and people who live in congregate settings, either very small houses with lots of people in them or apartments, or places like nursing homes, correctional facilities, dormitories. We know all communicable diseases travel faster in those places, and COVID-19 is no different than all of those. So if we go back to March, February even, hopefully in February, very few of you were thinking about COVID every day, but I can assure you those of us in the Department of Health Services were. And so this is data that our team was working on to help us understand the disease. And if you remember back to late February, early March, there were places in the world who had gone before us. Places like Hubei province, which is where Wuhan, China is, Italy, South Korea. And so our team plotted what we call the epidemic curve, looked at the number of cases and how they grew. And what this chart shows you is the navy blue, green, and purple lines are the epidemic curve we saw in Hubei province, in Italy, and in South Korea. And the black dots and the red line is what we were seeing in Wisconsin in late February, early March. And so what you can see is it looks like very quickly we were following the pattern of Hubei, of Italy, of South Korea, and soon after that of New York City. And so that led to very dramatic action, which was the Safer at Home order, which Governor Evers and Secretary Palm put in place on March 25th and stayed in place until May 12th. And what we found is the people of Wisconsin responded. They understood the risk. They did stay at home, except for those who needed to work in essential businesses. including construction. Construction did not shut down during that time. And we were able to stop this dramatically escalating curve and do what we call flatten the curve. This was especially important at that point in time because if you remember back to February, March, early April, we also were in the midst of influenza season. And so there was a double whammy, and particularly an effect on hospital beds. And what I would say to people in the beginning days of the pandemic is the goal is that the number of people who need a hospital bed is lower than the number of beds available. And thankfully, in the state of Wisconsin, we have always achieved that. So now we are no longer in what we call mitigation, which is shelter in place at home. We knew that was not a sustainable approach for the duration of the pandemic. It was to get us through that influenza season and get our hospital capacity under control, and we've begun to open up. So our strategy now is several-fold. One strategy is what we call harm reduction. I cannot tell you that anyone is safe going out of their house. The safest thing to do is stay at home and don't interact with anybody outside of your household. That is the safest thing to do. But reality is we cannot all do that, right? We have economic needs. We need to go to work. We have food and medicine and things we need to shop for. And we are social people, and people miss their families. So it still remains true that it is best to keep your circle of people very small. The fewer people you see, the better. But when you go out, there are things you can do to reduce the harm or reduce the risk. These are one of them. So masks is one. Physical distancing, staying at least 6 feet away. And this graphic shows you that's about the width of a typical sedan or a fishing pole or 2 grocery carts or 2 Labrador dogs. Wash your hands, wash your hands, wash your hands, wash your hands, and don't touch your face, which is one of the things with masks. Try to get a good fitting mask so we're not constantly adjusting them. We'll get better as we get used to wearing them. And then, again, stay home as much as possible. So that is our harm reduction approach, what each of us can do as an individual. And what I would say is we do that not only to protect ourselves, but to protect each other. And as the mother of a nurse who works in a hospital, to protect our healthcare workers who have really been at the front lines of this and are the ones who will be at greater risk if we don't keep the epidemic under control. So our next strategy is called containment. This is a public health word about how we box in the virus. And as you see here, when we were doing mitigation, we basically boxed in the people so they couldn't spread the virus. But knowing we can't continue to do that, what we need to do now is box in the virus itself. And we do that through 4 important strategies. One is we are increasing testing, and I'll talk a little bit more about that. When someone is identified as being infected with the virus, they need to isolate and stay away from everyone until their symptoms have resolved. We also need to understand who they've been in contact with because the virus spreads to other people before you have symptoms. So anyone you've been in contact with, either right before symptoms or once you develop symptoms, can be developing COVID. And so to keep them from furthering the spread, we ask them to quarantine. And so that's where this infamous old public health strategy of contact tracing comes in. And we'll talk a little bit more about that. So here is the incredible work that has been done in Wisconsin over the last several months. When we moved into the State Emergency Operations Center on March 16th, our state had a capacity of doing about 750 tests a day. It was primarily at our great public health lab, the State Lab of Hygiene, and the Milwaukee Public Health Lab, but those are small labs. And over the course of the last several months, we now have 80 labs in Wisconsin conducting COVID-19 testing, and we can conduct over 19,000 tests a day, or about 123,000 tests a week. This is really fabulous, and much of this is homegrown. The state has been working very closely with Exact Sciences that has stood up a COVID-19 testing. We have had numerous other labs. We have a partnership also with Marshfield Clinic in the northern part of the state that has done some significant increase, as well as many other labs in the state. And so our current state testing plan is really focusing on who should be tested. And here are who our priority populations are. We should test everyone who has symptoms. And this means even mild symptoms. When you have influenza, usually your doctor will tell you just to stay home, unless you get much sicker. But with COVID, we want everyone with even a mild symptom to stay at home, and for us to know they have the illness and stay at home, so we can also contact their contacts to stop the further spread of the disease. So sore throat, headache, runny nose, muscle aches, and then those things you heard in the beginning: fever, cough, shortness of breath. Those are all the symptoms of COVID. We want to test all close contacts of people who are infected with COVID-19. We want to test people in high-risk settings. In the month of May, we tested every resident of skilled nursing facilities in the state and the staff who take care of them. And we want to continue to do that kind of work to identify those places that are at higher risk. And we also want to test in settings where there is an outbreak, where there is a cluster of COVID cases, so we can identify and, again, box in the virus so that the spread of those incidents doesn't get worse. So we do this through contact tracing. And as I mentioned, contact tracing is something public health people have done forever, but it's now in the vernacular of people across the nation. And what this basically means is we test, we get results, and then we make contact with the person who is infected so that we can find out about the people and events and locations where they've been, where we could have had spread of the disease. So there's basically 3 levels of contact tracing. The first is the disease investigation, where we call the person who has been diagnosed and interview them to learn more about those places and events and locations and people they've been in contact with, and we reinforce the need for isolation. Then we call their contacts, let them know they've been exposed to someone who is positive for COVID-19, and ask them to be tested. That's fairly new. We used to just ask them to be quarantined, but now with the advancement of additional testing, we ask them to be tested and then still stay quarantined even if they are negative, because the disease can develop for 14 days after exposure. And then contact tracers also do monitoring visits. So they call people who are in isolation or quarantine to be sure that they are continuing to stay at home. We are deploying some really incredible technology as we're going forward to do this, including Microsoft Dynamics. If any of you have been out to the Alliant Energy Center, that's our pilot test site for Dynamics. And so this is going to make our both testing and tracing much more efficient as we move forward. And we're also talking about the possibility of using what are called proximity apps. That's something you put on your phone and it traces where you are. And then you know if you will get an alert if you were at the grocery store on Monday and someone who was also at the grocery store on Monday tested positive for COVID. It will just give you a sense of whether you need to be particularly cognizant of symptoms yourself. These have safety concerns and security concerns, and so we're being very cautious before we move into a proximity app. So our contact tracing is done in partnership with local health departments and additional states support. So we have funded our 94 local and tribal health departments across the state They are the experts in this. They know people in their community. They know where to refer people in their community if they have further needs for shelter, for food, for assistance while they're isolating. They know how to connect them with the local health system. So they're the first line of attack on contact tracing. But because we've seen so many cases and many local health departments have been overwhelmed, we now also have additional staff at the State Department of Health Services who are assisting local health departments when they are seeing surges. So let me end with a few comments about the current situation. So this is what we call an epidemic curve. You can see our curve was rising in April and then started to go down and then started to go up again and up even further, peaking initially in late May. And then those of us monitoring this thought we were going to see the summer reprieve. You can see through early June, our curve was going down, and we were really hopeful we'd see a pause in the outbreak. But as you probably have all heard in the news, both across the nation and as we're seeing in our state, we have seen a fairly quick and sudden upsurge. In fact, this data we first released about a week ago, 2 weeks ago now, and it shows you where we have high, medium, and low activity county by county. The darker the color, the higher the activity. And this is a combination of both what we call the burden of disease, or the number of new cases in a community over the last 2 weeks, not total, but over the last 2 weeks. And then the trajectory is, are we seeing increases in cases? Is it flat, or are we seeing decreases in cases? And I can tell you, when our staff first showed me this map 2 weeks ago, it was a lot lighter. Well over a third, approaching a half of the counties in the state were in that very light blue. So what we're seeing here in Dane County is also happening across the nation. This chart, I suspect the numbers are a little low for you, but what I really want to point out is that this epidemic has taken a toll, and a disproportionate toll, on people of color in our state. So a couple of highlights from here. While the African American population of our state represents about 6% of the population, if you look closely, you will see that they are 17% of the total cases and 24% of the total deaths. And so a population that has clearly been disproportionately affected by this. Likewise, if you look at people with Hispanic or Latinx ethnicity, they represent, again, about 6% of the state's population and 30% of our cases, although good news for this population, only 11% of deaths. Still almost double the state population, but not as significant as we've seen with the African American population. So these are deep concerns to us, and areas where we are working on targeting testing and contact tracing resources and other supports to stop the spread. So I'll wrap up with 2 slides talking about how we move from a statewide approach of safer at home to a more localized approach. And in Dane County, where I suspect most of your members live, we have our local public health. Madison Dane County has been incredible leaders in this work. They are well steeped in public health science, and they have been leading from the first case in Wisconsin, which of course was here in Dane County. And so when the state plan for sheltering in place and gradual reopening was no longer in place, Dane issued their plan, Forward Dane. As many of you know, we moved into phase 2 of that plan that has allowed further opening of businesses in Dane County several weeks ago, including increased allowances for people to be in restaurants and bars and taverns. Since that time, we have seen an increase in the cases in Dane County. here is their dashboard from June 29th. I submitted my slides Monday morning. They did put a new dashboard up Monday afternoon. And as a result of ongoing concerns in a number of both the disease prevalence areas and the public health response areas, they have made several orders, including changes in the bars and taverns, allowing only takeout food again, and again, the mask order that we saw. We know these are challenging decisions to make, but the county is making these decisions because they do not want to see that epidemic curve continue to climb at a rate that we would not be able to stop the extensive spread of COVID-19 in this community. And so I really want to, I'll close by saying it has been a tough time. We know people are sick of COVID. I will raise my hand and tell you I am as well. But the enemy is the virus, not each other. And what we really have to do as we move forward here is think about how do we best protect each other in our community, and how do we be patient while we wait for the scientists to produce the vaccine and to find adequate treatment that will ultimately get us on the other side of this pandemic. So let me stop there, and I suspect there are questions that have been coming in, and I'll turn it over to George to pose some of those to me.
And Julie, you are correct. Very informative presentation, and there are a lot of questions.
Okay.
So I know we have till 1 o'clock. If I could ask for the patience of everyone on the on this YouTube, that I want to answer all the questions. So if you need to get off at 1, please do so. But otherwise, the questions here are really outstanding. So the first one I would ask is from Rick Kiley. For a company reopening soon, what measures represent the gold standard for a safe prevention-forward office environment?
Well, there's a long answer to that question, Rick, and I'll highlight a couple of things, but I also want to refer you to some really good resources. Our sister agency, the Wisconsin Economic Development Corporation, or WEDC, has posted some really great guidance on reopening office buildings, businesses, all kinds of businesses, and I encourage you to go to their website and look at their guidance. They worked in close collaboration with the Department of Health Services. But if you go to my harm reduction slide, much of the work around how we make safer businesses is focused on that. How do we disinfect hard surfaces? How do we make cleaning supplies and hand sanitizer easily available? Asking our employees to wear masks, asking them to still stay 6 feet apart from each other, reducing the size of in-person gatherings. There are also environmental controls you can do that you'll find in the WEDC guidance around how you can increase air exchanges in your building so that you're circulating the air more. And then the final thing I'd say about that is really thinking about how important is it for people to be on site. I understand every business is different, but I think all of us have gotten, and you as a club have gotten amazingly good at being able to use virtual mechanisms to be able to do business and be in communication. So thinking about how you can continue to maximize remote work and virtual options is also very important, and particularly for your older employees and those who have those other diseases or live with people who are at risk.
Great. Thank you. So this is from Don Krim. If someone will travel by plane, what recommendations do you have for best safety measures they can take at the airport and on the plane?
Great question, Dawn. So the first thing I'm going to say, you're going to guess it, is don't fly if you don't have to. But I do understand there are family emergencies. There are situations where people need to fly. And so, again, I would follow many of the same prevention mechanisms. Work very hard to stay 6 feet away from folks in the airport. Keep your mask on. Keep your mask on while you are on the plane. Try to book on an airline that is leaving seats open so there are fewer people on the plane. And know that your biggest risk in terms of people on the plane are, again, those people who are within 6 feet of you. So that's usually 2 rows behind, 2 rows in front, and people on either side of you. The airlines are doing a great job of tracking where people are sitting in planes, and they've been a real partner in contact tracing. So if you are exposed on a plane, you are likely to be contacted.
Okay, great. And the next question is from Jerry Thane. What do we know about the long-term effects of the virus on those who have recovered after suffering from it? How likely is reoccurrence for those who have had the disease?
That's also a great question and a place we're continuing to learn. So our first hope when the virus came, because most viruses are like this, you have it once, your body develops antibodies to it, and you're not going to get that virus again. That's why we don't get chickenpox twice, we don't get measles twice. It's the whole philosophy behind vaccines. We have seen people who had COVID-19 who have been reinfected. We are learning more and more about the immune response to this disease. And so this kind of goes back to my original comment about the challenge of this is we are learning as we go, and we don't have a broad body of evidence. But people are studying this very closely because that whole issue of the immune response is also how we'll develop the best and most effective vaccines. We are also learning that the virus is not benign, and there may be longer term effects from it for some people. We have seen incidents of stroke in younger people, and of course, anyone who's ever had a stroke knows there can be long-term effects depending on how that incident affected your brain, and there may be long-term effects on lung damage and other things that we are still learning about. So it is a dangerous virus, and that is why we're so vigilant about these harm reduction and prevention counsel to you.
Okay, thank you. Next question is from Neil Furbach. He actually went and did his COVID-19 testing at the Alliant Energy, and he's saying, can the county set up an express lane at testing sites for those with symptoms?
That's a good question. And we are, again, constantly working on how we can improve our response, including our testing sites. We've gone very quickly from about 500 people a day at the Alliant Energy Center to about 2,500 a day. One of the things we are doing, and as I said, was a process improvement, was adding the DTRA, the Microsoft Dynamics application, which is helping to improve throughput. And the other thing is we're really working with our healthcare providers and encouraging them to be the first source for people who have symptoms to be tested. But I understand with the elevation currently in Dane County that some of our healthcare providers are even being overrun and don't have enough tests or slots to test, and so are sending people there. So I will take that idea back to our testing team, and thank you for that.
Okay, great. Thank you. The next one is from Karen Kendrick Hans. Is it feasible to reopen public schools K through 12 in September? And what extra resources and measures will we need?
That is a great question. I would call that the $1 million question right now. This is a very challenging decision to make. The Department of Public Instruction recently released a document called the Road to Recovery, which is counsel for local school districts to make decisions about reopening. We know with COVID, we're balancing many things, right? We're balancing children's need for education. We're balancing against education learning loss. We're balancing for the need for them to have socialization. We're balancing, from what I've heard from a lot of parents of young children, the need for parents to have a break. And these are all very important considerations, and we have to balance those with the risk of the virus. So again, many of the kinds of prevention mechanisms we've talked about, we're working with school districts. Some of you may have heard the governor announce yesterday that we are sending supplies of masks to all school districts, both public and private, throughout the whole state. And we anticipate schools will be, when they do reopen in person, will be asking their students and faculty to mask. Many school districts are thinking about hybrid approaches where they may have children there part of the week and do online learning part of the week so that they can decrease classroom size to maintain physical distancing. They can cohort children so the same smaller groups of children are together, which will also reduce disease transmission. And we're going to have to watch and make decisions as we go. Because again, as I say often through this, the virus will tell us as we move forward what we can and can't do. There is emerging evidence that children are not as high infectors as adults are. And if that proves to be true when we take on the grand experiment of bringing more children together, that will be good news. And I think we all have to be ready and nimble and flexible about we may have school and then we may have to close for a period of time and then maybe we retry opening. But we will all work together and figure it out as we learn more and as we go.
Thank you. The next question, I believe it says exit stage right, and I think it's Martha Sullivan. I can't tell from the picture, but other states are reporting shortages of tests. Where are we at in terms of stockpiles if the current trajectory continues to increase?
Well, right now, as I showed you earlier, we have about 19,000 tests per day available throughout the state. Now, one of the challenges is the tests might not always be in the right city or county where the demand is. But even that is getting much better. So we have about 19,000 tests per day available. Right now, we're testing anywhere from about 7,000 to 12,000 people per day. So right now, we're doing okay with supply in terms of total numbers. We are working with our labs across the state to continue to build that supply. And we are also, it has been a place, the state has been an important partner in being a purchaser of tests to be sure that we keep some of the good produced tests in our state here in Wisconsin and not leaving our state. So I think compared to other states, we're in better shape, but we need to continue to keep our eye on this because we know as the fall comes with increasing symptoms when we start to see influenza and common colds again, and as we start to see increasing symptoms as people come back into congregate settings like schools, we'll need more tests. And so that's something that's a very high priority for the governor and our response at this time.
Great. Next question by Charles McLymans, and his question is, when the new order goes into effect on Monday, will masks be required in gyms while people are working out? Any details about the order, I would have to refer you to Public Health Madison, Dane County, because they issued that order, and I'm sorry I haven't studied it. So I don't know the answer to that. I apologize. No problem. Next question for Janet Periano. Please give us your thoughts on when we might expect a vaccine that is effective enough to allow us to reopen safely and return to some level of normalcy.
Oh, Janice, I wish I knew the answer to that question. The good news is we understand there are, I read in the Wall Street Journal that there are about 3 companies getting ready to move into phase 3 of vaccine testing later this summer or early this fall. I've heard Dr. Fauci say maybe shortly after the first of the year, but I think every prediction about vaccine we need to use an air of caution with because this is a tricky virus. It's different than normal influenza. And as we get into phase 3 vaccine, that's where we're really going to see with large populations of people if we're conferring immunity or not. But this has been an effort like no one has ever seen about scientists coming together, sharing information, being well funded to get us to that vaccine. And it's something I dream and hope about every night. And I'm happy to hear about the progress, but I think it's a little too early to say a date specific when it'll be available. Thank you.
So I want to thank you to Dr. Julie Willems Van Dijk for presenting to us today. Just truly an outstanding presentation. A lot of great questions. And Dr. Van Dijk, we made a contribution to the Rotary International Polio Plus Fund in your honor. Thanks for speaking to us today. And really appreciate all the questions. And please share this presentation with your fellow Rotarians, family, and friends, because this has been unbelievably informative. And again, I want to thank Dr. Julie Willems Van Dijk and all the people who are on the front lines of this battle. I mean, if you think about it, her organization is coming up with the battle plans so that we can effectively defeat this virus and deal with this pandemic. So it's a tough job, and I'm glad we've got leaders as sharp as her responsible for leading this effort and coming up with the plan. So that's a phenomenal job that organization is doing. So thanks for everyone that joined us to today's meeting, and we are adjourned.